No, I remember. I believe that you remember my name. I don't need to introduce myself. But anyway, it's time for gynecology, and it's time for new lecture, new part of knowledge. It's second semester knowledge. And this semester, we need to start to talk about pathological conditions. But first, we need to continue to talk about general situations which could be in gynecology and which could be in your practice during life. Guys, no, it's not necessary to remember to you that after 1.5 years you will be a doctor, and like the result, you're gonna start to treat persons, and you can meet different conditions in your profession. You can meet different disorders in your profession. Anytime I try to tell that, don't forget that around of you, you will meet many different persons. I'm not talking about patients. All of them will be ready to ask you, what do I have? What kind of trouble I have? What do I feel? Can you recommend something to me? What to do? Where I need to go? What kind of disorder it can be? And you should be able to answer for that small questions from your father, from your mother, from your friends, from your girlfriend, from any persons around of you. And some conditions, no, you will meet anyway. Very difficult to imagine that you're going to meet some polycystic ovarian syndrome in your life. Very difficult to imagine that you can meet some cancer of the ovary in your life. But such story like acute abdominal syndrome, you will meet anyway. You will meet anyway. And you should be able to imagine in your head correct primary tactic to save the life like that, because abnormal tactic can result in the formation of the abnormal diagnosis. Abnormal diagnosis is the way for abnormal treatment. Abnormal treatment is the way to the death. And I can tell you many different stories and samples from my life, from my practice, which I saw, which I was person inside of that stories, where I was inside that stories. And believe me, no, that story is not very funny. And the result of the incorrect management is the possible death of the persons, possible death. And I believe nobody of you is ready for that. Nobody of you is ready for that. That's why try to pay your attention. That lecture is not very difficult. It's not very difficult. It's understandable, very easy to imagine, very easy to get information. And if you will put that information in your mind, you will be able to find main stories which can be in the practice. Okay, let's start. In the beginning, what I need to tell you, what is it? Acute abdominal syndrome. What is it, acute abdominal syndrome? Very easy to imagine. What is it, acute abdominal syndrome? Don't forget, you during your classes need to correct formulate diagnosis. Don't try to tell some big stories, many words. You don't need. For better understanding, you need to memorize that acute abdominal syndrome is just a pain in an abdominal region. Duration of the pain should be less than 1 week. Any pain which you can feel in your life actually could be put inside the group of acute abdominal syndrome. Memorized. Why we need to memorize? Because inside of such small story like the pain in the abdominal region could be very serious disorders, and we should be very serious and should be ready to formulate correct understanding why you have that pain, why your persons around you or patients around you has that pain. For better understanding, for the primary view, you need to, inside of your mind, imagine the abdominal wall like the space where you can draw 4 lines, 2 horizontal lines and 2 vertical. No, like that. Like that. Try to imagine. We are talking about the abdominal region, umbilicus, chest. Just draw that line, like that. And with help of that line, you will be ready to formate such imagination. You will be able to find the region where that pain is. And it will be the first step inside your primary management. Each region should be named. How can we name it? Very easy. Right iliac or right hypogastrium, right middle gastrium, right hypochondriac, or right epigastrium, middle epigastrium, upper epigastrium, left upper quadrant, middle quadrant, different names can different. Just imagine, you can name it like you want, but just imagine where is it. And it will be the first step inside of your management. You need to understand that in case with acute abdominal syndrome, we can need different diagnoses, or take a look for that. Each of the diagnoses could result in the death of the person. Acute appendicitis, the most favorite diagnosis in the surgery. Acute cholecystitis, acute pancreatitis, ectopic pregnancy, if we're talking about our disorders, acute peritonitis. All of the diagnoses is the way for surgery, way for serious condition in the life of the person. That's why just read and memorize. Primary, I can name to you not less than 200 disorders which can result in acute abdominal pain. That's why for better understanding, first step that you need to do to formate imagination. Where is the pain? Where is the pain? Next, you need to memorize the type of pain could be different. Could be different. Could be 3 main types of pain: visceral, parietal, and referent. And you need to continue. It should be together. In the beginning, you need to understand where is it. And with that, you need to think what type of the pain that person has. What are the difference? What is the visceral pain? It's the striation of the fiber innervating the walls or capsule of hollow or solid organs. Due to inflammation, due to ischemia, not just stretching. It's the pain which inside the organ, inside the capsule of organ. And we need to memorize visceral means organic pain. Could be parietal pain. It should be due to irritation of the receptors inside the peritoneum. And that receptors could be irritated by different conditions: inflammatory, pus, fluid, another type of pressure. And the third type of pain, referent pain. No, it is felt at a location distance from the diseased organ. For example, person has heart trouble, or spine trouble, or trouble with their nerves. Like the result could be referent pain at the distance. And depend of your imagination what type of pain that person has. We'll see with you different tactic in the future. That's why location, possible type of the pain. First 2 questions you need to ask yourself. What else you need to format and put in your diagnosis, in your mind? So you can forget everything, but don't forget that rules like you see here, 3 G's play a role. It means that could be gastrointestinal, gynecological, and genitourinary. Actually, all organs which can be inside the cavity of the abdomen could be involved in pathological process. Gastrointestinal tract, bowel, liver, stomach, gynecological organs, and urinary tract. No, what we name it genitourinary, but it's just a way which we go to at least understand it and memorize. 3G. Location, possible type, don't forget about 3G. What causes can be? Hemorrhage can be, could be perforation, could be another type of disorders, no, just memorized. After that, if you found primary place of the pain, you need to memorize and imagine what type of organ is inside that location. For example, if you have epigastrial pain, what it can be? Most common reasons, peptic disease, ulcer, aortic aneurysm, cholelithiasis, diaphragmatic defects, gastroenteritis, pancreatitis, different tumors. If you're talking about right upper quadrant, could be abnormal located appendix, inflammation of it, could be cholelithiasis, liver-related, hepatitis. Left upper quadrant, colonic ischemia, pancreatitis, renal, splenic pain, infarcts, abscess of that location. Mid-abdomen, aortic aneurysm can result in that. Appendicitis, small bowel obstruction, ischemia, suprapubic, no, lower middle quadrant. Different synonyms can be there, just name like you want. Gynecological reasons, most favorite disorder which can result in the pain at that region. All locations, no? Different infections can result in it. Irritable bowel syndrome, peritonitis. Found primary story. After that, you need to formate another questions. Where you asked, you need to ask when, what kind of pain, does it irradiate, did it move, previous episodes, modified factors. All that questions should be asked. It's not very easy. Contact with the person is very important. You need to formate normal conversation with the person. If you can't talk with the person, you need to talk with relatives, with the persons who was with him or her in the beginning of the disorder. One more time, where? Possible the most important piece of information. Take a look for the picture, guys. I said you the different location could informate us about different disorders. Why? Because it's very easy to memorize, guys. Very easy to memorize. Take a look for the picture and you understand that different locations formate different understanding in accordance with the location of organs. Take a look for you can draw it yourself. Let's do it together. Let's do it together. One more time. I'm gonna draw the picture and you can try to do it yourself at home, just like for the practice. Let's formate abdominal wall. Let's try to find first what? First, let's try to find gastrointestinal tract. What we have with you? Stomach. After that, small bowel. It goes in the ileocecal angle with the cecum. Appendix is here. It goes, next part of bowel goes like that. It goes to the sigmoid part of bowel and rectum and goes outside. Easy to memorize, very easy. What else should be here? Liver. Somewhere here. Inside of the liver, what should be? Yes, no? Part of liver. Cholecystitis, where it can be? Here, typical location. Spleen, typical location. What else we need to understand and memorize? Kidney, somewhere here. Ureters. Bladder. And our organs, huh? Uterus, fallopian tubes, ovaries. Just memorize that picture, guys. No, one more thing that we need to memorize. Pancreas. And what else? Somewhere here should be heart with big blood vessels. Aneurysm can be. Memorize the picture. Try to draw it at home. If you do it one time, 2 times, you will put it in your mind and you will be able to draw it. And after the starting of the pain, after your first watching for the person with the pain, you can imagine that picture and tell primary location of the pain in accordance with your understanding. Believe me, it will help you. Anyway, it can help you. If you be able to draw that picture, you'll be able to find what type of pain the person has. Same story, you can see it here. Main diagnosis which you can meet at this picture. It could be man, same story. Same story, and you need to understand that difference between male and female organism inside the cavity of the abdomen depend of just presence or absence of gynecological tract. You can try to help for the male person in accordance with your knowledge. Take a photo of that picture. In the beginning, I saw you main reasons of the pain. Here you can memorize and screen the picture, which can help you in the future. Don't forget that could be diaphragm, trouble with the bones can be, iliac region can be there, and that story can play a role too. What kind of pain, guys? What some classic patterns? Take a look. Obstruction, crescendo, decrescendo. Pain go up, go down. Typical story for obstruction. Burning, typical story for ulcer. Tearing, typical story for aneurysm. And sometimes person can tell you, I have burning in the upper part of the abdomen. First, your mind should be about ulcer. Take a look for that picture, or typical story for our disorders. No, I go forward a little bit, but we need to memorize. So take a look. Number 2, obstruction of the lumen of a hollow organ. It could be, for example, uterine abortion. What this crescendo descent, if the location is typical for us, we need to think about abortion. Or, for example, number 1, perforation of whole organ. What organ could be perforated? Cyst, ovary, go up and after that go down. Chronic pain, like at the number 3. Take a look. We don't see with you increase of the pain. Or tubal pregnancy, tubal abortion, like in picture number 2, in the line number 2, but intensification of the pain will be not such serious. Does it radiate? Typical radiation patterns, guys. What biliary colic we can expect for the right upper back irradiation. Upper mid back, aneurysm, pancreatitis. Groin testicle, renal colic. What in gynecology we have? Irradiation in the rectum can be due to pressure at the Douglas sac because of collection of the blood. If you have the person with the irradiation in the rectum, think about hematoperitoneal, presence of the free blood inside the cavity of the abdomen. Did it move? No, all of you can tell now that the typical pattern for appendicitis is the movement of the pain from umbilical or epigastrium to the right lower quadrant. Typical story for appendix. Typical. Previous episodes. Okay, it's no difficult to imagine that person. Sometimes we can meet in our practice that person can tell, I had it when I was pregnant. I had it when I previously 1 year ago when I was operated for cyst rupture. It can help to you. And that questions play serious role. Don't forget, ask persons. Good conversation, good contact with the person plays serious role. Sometimes different factors can play a role. Make it worse if you're talking about the food, make it better. Sitting that can decrease the level of pain. Pain irradiation, take a look, like that can be. If it go in that way that you see hepatic biliary pathology, nephritis around of the back, nephrolithiasis. Why that way for the pain can be? In a way of ureter. Sometimes we can meet with you non-surgical causes of the pain. Non-surgical types of the pain. What are they? Take a look. Pneumonia, pericarditis. And we need to be ready for that story. The different disorders can formate serious pain in the abdominal region, and that story plays serious. It should be inside of our mind. But take a look for such statistical information, guys. Such statistical information. Such statistical information. What was made big investigation, and investigation inside of that investigation included more than 10,000 persons. So, no, different stories. I don't believe it sometimes, but that story very important. Take a look. Non-specific abdominal pain can be meted in 38% of cases. 38. For female persons, 86% was with the acute gynecological diseases was with 4% of causes. With some kinds of trouble here. Take a look. We'll take a look down like that. Oi, no. Sorry. Like that. And inside of the group 4%, if we are talking about acute gynecological disease, take a look. Ovarian cyst and ectopic pregnancy play most serious role in the formation of abdominal pain. But anyway, first place will be for the non-specific abdominal pain. What else can help to us to formate our primary diagnosis? No, of course, different type of investigation. You can see here main investigation which you're doing in case if you have the primary meeting with the person with the acute abdominal pain. Don't forget that we need to do all analysis that we can to do specific for us ultrasound examination, beta HCG is very important. But of course, if you have increase of the white blood cells, trouble with the red blood cells, it can play a role in the formation. But in the first part of my lecture, I was trying to explain to you that you need to work like a, like emergency, like the person who is ready for everything. And first contact, first meeting, and primary subjective investigation play a very serious role for the correct management in the future. Some important signs in patients with abdominal pain. Memorize it. It's not for us, actually, for gynecologists, but take a look for that, read it, and memorize. Maybe it will help to you. If you meet it in your life, just be ready. What else? Another sign that you see. Now let's talk about acute pelvic pain and gynecologic emergency. Why pelvic? Because, of course, in the beginning, I was trying to explain to you that abdominal pain could be in different reasons. But here you see specific region for gynecological disorders. We name it gynecological triangle. Umbilicus, pubis, and lateral parts of the pelvis. But if you have pain inside of that region, further you need to think about gynecological disorders. What kinds of disorders you can meet with pain syndrome? Complications of the pregnancy, ectopic, abortions, postpartum or post-abortions disorders, infections, adnexal accidents, ovarian torsion, ovarian rupture, ovarian hemorrhage, cyst of the ovary, another name, ovarian rupture, ovarian hemorrhage, other gynecological problems, endometriosis. Sometimes ovulation can result in that. And about each of them, we need to talk. 1 second, guys, 1 second. I'll stop the demonstration.